4 o'clock, so let's get started.
Let's get
Welcome to all of you that are here already. I am Stacy Stark, Director of Marketing for Lexley. We are so excited to do this, our very first Facebook Live interview. We don't know what will come of this. This could be just, one big gaffe, but we are looking forward to talking to all of you. I'm excited to be here with Dr. Abdullah.
And I'm excited to be here too because I'm here and Stacy's talking to this camera that I'm not sure is going where.
We told him this would be a great idea. He's always game, so we're just going to have a lot of fun with this. We gave you all the opportunity to submit questions for Dr. Abdullah in advance, and we've gotten lots of great questions. We're excited to get to those, as well as the questions that we know will be coming through today. So let's just dive right in. Before we do that, actually, we have two winners we'd like to announce for the giveaway. Two winners who will each be receiving a $50 gift card for Lexley, as well as a copy of Dr. Abdullah's book, Simple Skincare, Beautiful Skin. The winners are Sherry and Amy, and we will contact you immediately after this broadcast to give you details about how we will get your prize to you. So thank you for entering.
Congratulations, Sherry and Amy.
Yes, so great. Let's jump right in.
How exciting.
We have a question from
Did
Diana.
I win anything?
You win every day, so no gifts for you.
Darn.
Diana asks if there is a product that will help fade sunspots and dark spots from old breakouts, and this is also a question that was posed by Heather, who is dealing with pregnancy-induced melasma that didn't go away after her pregnancy. And so I know you get a lot of questions about hyperpigmentation.
Yes, I do, and that's and the reason you get a lot of questions about that is because it's a very difficult problem to address. Let's answer the second part first, which is the pregnancy-induced melasma. I think the important question, the return question for me would be how long ago was the pregnancy? Because most often that will get better over time. Now, sometimes it takes a while, a few months, maybe even a year or so. So if the pregnancy was a few weeks ago, or the end of the pregnancy was a few weeks ago, it may be too early to say if it needs to be treated, so to speak.
Because that often fades
It
over
fades
time,
over
correct?
time on its own. And I think the important thing to remember is that melasma is hyperpigmentation because the melanocytes that produce the pigment have been activated, let's put it this way, or hyperactivated. And so we don't want to stimulate them any further. So during the time while you're waiting for it to kind of go away, wearing sunscreen becomes very, very important because any UV exposure to those areas is just going to keep that process going.
And that area will appear darker than other areas
Correct.
of skin. You'll continue
Correct.
to make it worse.
Correct. So pregnancy-induced melasma sometimes will take a while to get better, and that's important to remember. So you shouldn't lose, faith in it, in the process after just a few weeks.
And as far as treatments for hyperpigmentation, there's a lot of ingredients that are effective in the
Yes.
treatment.
The main ingredient that's been effective over a period of time that's been shown is hydroquinone, and hydroquinone comes in various strengths, if you may. But hydroquinone is a chemical, and it does have some side effects that people don't particularly want to have. I think one of the more gentler but fairly effective ingredients is kojic acid. So there's a lot of products with kojic acid now that are fairly effective. The problem with hyperpigmentation is not as simple as it's just that you've got lots of pigment. Pigment is made and then it breaks down. And there's enzymes and processes that are involved in how fast it's made and how fast it's broken down. And everybody's going to have a little bit of a different pathway, let's put it that way. In some people, the breakdown is not happening fast enough, and so the pigment builds up. In some people, the breakdown is happening at a normal pace, but the production of melanin is increased. And so knowing kind of what's going on is difficult at this point to know. So it's a trial and error thing. The other problem is that if the stimulus for the pigmentation continues, such as hormonal-based,
As in pregnancy.
as in pregnancy or
menopause.
or then no matter what you do to try to get rid of the symptom, If the cause is still there, it's difficult to address that. So there's the easiest hyperpigmentation or melanin formation to get rid of is tanning. Tan based. When we're younger, we get a tan and then it goes away after a few days.
Right.
Now we're causing other problems and other issues that are going to come up later, such as skin damage.
Right.
But inflammation, that's basically inflammation-based hyperpigmentation, and that's easy to control because you can control the inflammation, you control
the cause.
The cause, and so treating that is easier.
As far as products, so there's the prescription strength hydroquinone and other products like that you would see your dermatologist or your plastic surgeon about. But what about over-the-counter products?
Well, over-the-counter products, basically, like I said, kojic acid is probably the main standby, if you may, for using for hyperpigmentation. And it does work very well, especially in inflammatory-based hyperpigmentation. And of course, with that, sunscreen becomes very important. So, I mean, sometimes inflammation-based hyperpigmentation is because of sun exposure. And so you start using sunscreen, it's going to get better.
Okay. And
so you're really needing to know the cause of that hyperpigmentation is really important, and that's very individualized.
Right.
And that's why it's so difficult to treat in a lot of cases because, for everybody the cause could be a little bit different.
Lexley has a product called Lightning Lift, which was originally formulated for hyperpigmentation, correct?
Actually, that's got an interesting history. It was originally made as a facelift in a bottle. And I thought, well, it was for the Japanese market. At one point, we were selling quite a bit of products to Japan, and they wanted a facelift in a bottle. And I said, well, I can do a facelift with a knife, but in a bottle it's kind of
a little bit harder.
a little bit harder.
A temporary facelift in a bottle.
So basically,
it's
a mask. So it started off as a mask, and I thought, okay, let's make it more effective. If you're going to put it on as a mask, the other big thing in Asian countries is trying to get lighter.
Right.
Versus here, we all want to get a tan.
Right.
And so putting a lightening agent in that was kind of natural for me to do. That's why it's called a lightning lift. The lift part is the mask.
Yeah.
And kojic acid is
the lightning.
Lightning.
And so with a
ingredient.
product like Lightning Lift that requires regular use, and with regular use, you will see those areas of hyperpigmentation lighten.
Absolutely. Those areas of hyperpigmentation that are post-inflammatory or where the cause is temporary or controllable, then those will get better.
Okay, wonderful.
And so one of the uses that I have for it is when I'm going to laser somebody's face for wrinkles or what have you, we use it as a pre-treatment. So as a pre-treatment, when we use it, we actually quell the activity of the melanocytes, and so when they get zapped with a laser, they don't
darken.
They don't pick up the activity as fast.
Okay.
So it's a good use for pre-operative in my office for lasers.
So the answer to the question then for Diana and Heather, Lightning Lift is a product that is effective. There are certainly other ones out there. That is the one that's offered by Lexley.
And I think the important thing is that when you talk to your healthcare provider or plastic surgeon or dermatologist, is for them to try to figure out what is the cause of your pigmentation. I mean, sometimes you won't know, but a lot of times it can be figured out from hormonal questions and what's happened.
Yeah. Okay. Part of that question was about acne pigmentation, and so it takes us a little bit further on the topic of acne. Kendra mentions that she has bad hormonal acne, something that we know can be an issue for women of all ages. At an age when we feel like we really should be done with acne, our 30s, our 40s, it kind of surprises you. The Lexley Acne Kit has been proven to be a really effective remedy, not only for women, but men as well, and people of all ages who are dealing with different severity of acne. Kendra's question, though, relates to acne on the back and the scalp and how you treat that. I believe she's an Acne Kit user.
Sure. The Acne Kit is not necessarily for facial use only. Because the reasons or the causes of acne are the same no matter it's happening on your back or the face. There are 4 main causes of acne. People who are prone to acne will have more oil production, more sticky cells, so they don't slough off as easily, and so they clog the pores. The bacteria in the propionibacteria, which is the bacteria that cause acne, seem to like to live in the skin of certain individuals, and then of course inflammation. And so those things can happen on the face just as much they can happen on the back, on the chest, on the scalp. So the treatment of acne in any area really is to address those causes, which would be similar. And the acne kit is designed to be used for all those areas, and should be. Now, like the acne cleanser on the face, we don't use as much because it's face. So you may need to use a little bit more on the back and leave it on a little bit longer just because the absorption is a little slower because of the thickness of the skin or what have you. But at the end of the day, treatment of acne is the same no whether you're using it on, whether you have it on the back or the scalp. Or the scalp is a little bit harder because
right.
the scalp, because of the hair and some other issues. But again,
the cleanser
can be used.
Yeah.
I wouldn't use just the cleanser. I would certainly use that and then use a good conditioner afterwards.
To prevent, you're going to have
prevent
potential
dryness.
for dryness.
Correct.
Okay.
Correct.
So any other questions about acne, certainly send those in to us. But let's move on. And you brought up inflammation. Inflammation is something that I think is relative to this next question that we got from Jen. And it says, in your opinion, what is the biggest skincare issue we face? I have a feeling that that's...
I think you already gave me the answer.
I was going to say, I know you well enough that I think that's going to be your answer.
Yeah, when you think about it, every problem on the skin has an inflammatory basis to it. I mean, from sunburn to psoriasis to eczema, certainly acne. Inflammation is a root cause or a root problem that exacerbates the underlying issue. So if somebody is born with psoriasis, inflammation is what makes it worse. The dryness causes inflammation then makes the whole problem worse. So if we can treat inflammation for almost every skin problem first, we can address the root cause for that specific issue, whether it's a rash or what have you. There's a reason why most time when you go to a dermatologist, what's the most common drug you're prescribed? Steroids, right? Steroids are the most effective anti-inflammatories out there. And so when you use steroids, you're quelling inflammation. And that's the reason for, in the Lexley products, I start with a base of aloe. Aloe is a natural steroid, if you may.
Yeah.
And it's not related to the steroid in the molecular sense,
right?
But it's an anti-inflammatory.
It's been clinically proven many times.
It's a very potent anti-inflammatory. We use it in burns, and that's the reason we use it, because it's an anti-inflammatory. And so using anti-inflammation in skincare products becomes so important because skincare is quelling the inflammation that can cause
these other issues to develop.
Not just cause, but exacerbate some that are not, where the cause may be something else. You can have a cause of such as bacterial infection and get a rash from that. Well, the rash eventually becomes exacerbated because of the inflammation, so you got to treat both.
You've talked about it as a fire in your house, and the fire department comes in.
Well, that's inflammation.
Yeah.
In the skin, we can see that on the skin, even though inflammation is a root issue with a lot of our organ systems. It's been shown coronary artery disease is, inflammation makes coronary artery disease worse and worse and worse. Diabetes, it's been shown inflammation in the islets of Langerhans and the pancreas, which make insulin, make that worse. So inflammation is a root cause for a lot of problems. And the skin, I call it the hurt sandwich. The skin has got external issues that can cause problems, such as sun exposure or trauma or bacteria, and then internal issues of how healthy we are, and how healthy we are, what we eat, and what we do
Our
affects
activities,
affects our heart and lungs and kidneys just as much as the skin. So the skin is kind of attacked from both sides, and so it's got multiple reasons to get inflamed, if you may.
Right.
So,
And so then the answer is, you don't only treat it topically, right? Products like aloe vera are very beneficial, but you also have to ensure a healthy diet, and yeah, we're losing you here, so we'll get you a little closer. And ensuring healthy diet, staying hydrated, all these other things that are beneficial, right?
Absolutely. Everything that's beneficial for us, for internal organs, is beneficial for the skin. The skin is the largest organ, so we got to take care of it, but we got to take care of it in a double way, on the outside and the inside. And actually, aloe vera is a great internal and anti-inflammatory too, because you can drink aloe vera.
Drink aloe vera juice, right?
Juice.
Correct?
Actually, they have you can get all kinds of stuff.
Yeah.
In Lexley, we don't dabble in that, but
But there's plenty of supplement companies that do, right?
Correct.
We have a question coming in from another Jen. This is Jenny. What does Dr. A recommend for reducing the visibility of scars?
That's a great question. The best way to reduce scars is not to get them in the first place. But unfortunately, as human beings, we heal by scar formation. We can't regenerate our tissues. So scar is different than, and that happens whether it's inside or outside. And so if we have surgery, say, on our liver, and the liver heals back, the scar that heals it back. Well, on the skin, you can see that scar. And the scar is a permanent structure, healing point, if you may, from the damage that caused it. How do you reduce it? Well, there's many ways that, all the way from surgical lasers to skincare products, but I think the key in scar is preventing having bad scars, certainly outside, is the first year of a scar's life. So this is really important, that if you get a cut or a surgical scar, or that first year of that scar's life, you can do things that are non-surgical to make it better, like putting pressure on it, like making sure it doesn't tan, and that'll give you, because at the end of the day, we want the scar to be the skin color and as flat as possible. That's the best we can do. And the flatness comes from pressure, so scar massage is really important for that first year. After the year, it's fixed.
What if it's an acne scar? Do the same rules apply?
Well, acne scars, the same rules apply, but acne scars are more difficult once they're formed, just because they're more like pits, and you can't really flatten a pit. If you get a scar on the hand, or you get a scar from a cut, it's usually raised, and you can flatten that. So, but acne scars in this day and age, with acne products that we have, really should be preventable. So prevention for acne scars is a lot easier than trying to address them afterwards.
So you have to go backwards, proper treatment of the acne to prevent scarring, and then after you have an acne scar.
After you have an acne scar, then there are procedures we can do, such as these lasers or dermabrasion, things like that, that can reduce it. There's not a lot of products out there that are going to make scars a whole lot better.
You're best off with a professional treatment at that point.
Best off is seeing a dermatologist or plastic surgeon or what have you, and seeing what kind of laser options there are and what kind of surgical options there are. And sometimes we can, if they're deep pits, we just cut them out and turn them into a linear scar that's flatter.
Less noticeable.
So that's less noticeable. So there, and it all depends on how bad they are. Sometimes just treatments with exfoliation. As we age, say it's somebody who's older, who's got acne scars over time, and in their 30s and 40s, and now the skin is starting to loosen up a little bit, you get a little loss of facial fat volume. You can do injections and do some fillers in that scars. You can use exfoliation to tighten the skin so the scar looks better, if you may. So there are things that we can do that are non-surgical for scars, but we can't make them go away completely.
Right. Okay.
So prevention, especially acne scars. I think one of the problems I see all the time is kids, especially young boys growing up, well, acne at, teenage years is normal.
Right.
You're going to have acne. Well, you're going to have acne, but in this day and age, you can control that acne till they grow out of it.
Yeah.
And prevent that scarring.
Minimize the potential
right.
for long-term damage.
Right.
Make it just a period of their lifetime instead of something they wear for a lifetime.
Correct. I mean, acne untreated will cause scarring.
Mm-hmm.
Well, if you treat it and keep it under, and keep it under a certain level of damage, then you'll prevent the scars in the future.
Yeah. I just want to take a minute because we've had a number of new people joining us. Some of these names are familiar. We wanted to just join everyone. There's Lynn. Hi, Lynn. Melody, Jennifer, Autumn. We have some people here from Minneapolis. So welcome to everybody. This is really great to see this audience grow. We're excited to do it. As I said, this is our very first Facebook Live broadcast with Dr. Abdullah. Please send in those questions. We have a good long list that we have gotten over the past few days. So we certainly aren't short of content. We are going to try to get to as many of these as we can.
I'm certainly not short in words.
No, you could talk all day. We usually have to. So let's get to another question that I think is so relevant to our brand, and that is, how often should I exfoliate? Of all of the customer questions that we get, this is probably one of the most common. Because what we say for use of Aloe C is often different to what other brands are saying for their exfoliant. So it confuses people.
Right. Well, I think, first of all, we need to clarify some terminology. Okay? Exfoliation on a daily basis is very important, and we'll get into that in a second. But a lot of people confuse the term exfoliation with peels. Well, peeling is exfoliation, but in an extreme fashion.
And I suppose we also confuse people a little bit because we often talk about how the pH of our product is similar to a doctor's office peel.
Peel, correct. Well, and that's because we're the only ones who kind of do that, because we're really the only product that is in that category, if you may, now.
With such a strong
base of with such a strong acid in it.
Yeah.
So it's like a peel, but not a peel. It's a peel level product that just gives you exfoliation.
Yeah.
And that's not a concept that goes hand in hand. So most people, exfoliation is either gentle exfoliation, which I think is a contradiction in terms.
A complete misnomer.
Which means you take something and you rub it lightly on your face and you're exfoliating.
Yeah.
Well, you're not.
Yeah.
You need force to exfoliate. And like I give the example of men shaving. If you look at men's faces who shave regularly.
Want to make sure you keep scooting over. We're going to lose you pretty soon.
No, I'm just kidding. Okay, so the point is that shaving is a pretty harsh process.
Right.
But you're using blades that are cutting through those hairs, but they're also shaving those dead layers of skin at the same time. But you're not causing inflammation, and so and those areas in men's faces that are shaved every day look a lot better from a perspective of healthy skin.
Yeah, it looks younger, smoother.
Yeah, than up here or on the forehead where
Yeah.
you can see the sun damage, you can see, all the damaged age spots and things like that.
Right.
And that's because they're exfoliating. So exfoliation without inflammation is the key. Peeling, especially in a doctor's office where you go get this acid thrown on your face and you come out smiling and you even pay for it. Well, think about all the inflammation that's caused by that.
Right.
Okay, and it takes days to heal, and you're sloughing all the skin, and you're pink for a while, and
it certainly
burns,
works,
and it
right?
burns,
Yeah.
and it works.
Yeah.
It works great. Now you can't do that every day,
Right.
and I think that's where the confusion lies, is because that's what we're taught. You can't burn your face every day. Well, that's true. You can't.
Mm-hmm.
But there was nothing till I kind of came up with Aloe C, where you could actually burn your face without burning it every day.
Right, without
And
the
that's
effects of it, the painful effects of it.
So peeling is exfoliation with inflammation. Exfoliation without inflammation is something you need to do every day. Does that make sense?
Yes.
So exfoliation without inflammation is what we want to talk about. And peeling is usually exfoliation with inflammation.
So, as it applies to alloglycine, you do want people to at least work up to a twice daily application of that product, correct?
I think that would be ideal.
And not everyone will ever be, we can't assume that all of our customers will ever be able to get to that. Everyone's skin's different, right? Or is that wrong?
I think everybody's skin is similar, except everybody's skin damage is varied. So if you've got a lot of sun damage, a lot of skin damage, you've got skin that's a little bit older, has got some collagen degradation because of age, and elastin isn't as good. Well, that's just going to take more of an effort to get from point A to point B, looking better. You take somebody who's got great skin like you, well, you're going to look great. You're going to keep looking great. You're going to maintain that easier. So the point is that it's not, the skin biology is the same. It's where you're starting. And I've had people say, well, I've been using this for a little while, but I don't. It looks better, but I need, I need to look even better. And that's where I think something like a peel would come in. You go get a peel, and then that kind of kickstarts the process because it gives you a deeper exfoliation, if you may. You let that heal, let the inflammation get better, and then you maintain with something like L-glycine.
Which is how a lot of the estheticians that
Correct.
carry our products do recommend that it be used.
Yes.
I know
So
that
it doesn't take the place of a peel for depending on how much damage we're starting with.
Right. And if your skin, so sensitive skin is another topic we could get into, because I
Yes.
know that if you have what is perceived to be sensitive skin, it can take you a while to get used to alloglycine. But you have I learned something from you about sensitive skin
What?
that I think is fascinating, and I think it's worth sharing
Yes,
here.
and I think again, sensitive skin has to be defined. Okay, and most commonly, if we have an allergy to something, and like 6% of the human population is allergic to fragrances. So somebody is allergic to a fragrance, they have sensitive skin. Well, that may be a real allergy, and that sensitivity is different than people who say, well, I put something on, it just burns a little bit, or I get more red.
And my skin's really sensitive. That's what they
So they say,
assume.
so my skin's really sensitive to that. That may just be damaged skin. Because
That's the piece
Right.
that I think is eye-opening to people.
Absolutely.
That sensitive skin is in many cases just skin that has been very damaged and
Correct.
needs to become optimized.
Right. So like I talked in the talks I gave, damaged skin is basically the layer of skin that's not optimal is the dermis. The dermis is where the money is in the skin. I mean, if a thick dermis is protective, it's got a great immune system, it's got good regeneration going on, and so it's a very protective layer for our for the whole skin envelope. And if the dermis gets thin over time, which is what damaged skin basically is, and the fibroblasts, which are the cells in it working suddenly, if you look at damaged skin on a microscope, you see very few fibroblasts. So basically the factories are closed and not much is going on.
Right.
Well, so it's the immune system is not going to be working as well. So if in a thin dermis, thin damaged dermis, that skin is going to be more sensitive because you got your protective layer is lessened. So anything will burn more and cause more inflammation, cause more burning or itching or whatever. And so people say, well, I've got sensitive skin. Well, the sensitive skin is a symptom. The problem is a thin dermis. So in fact, in those individuals, if you increase, say, exfoliation on a daily basis, and which rejuvenates your dermis, that sensitivity will get better as the skin improves its health.
It seems counterintuitive.
Right. I've got sensitive skin, so I'm going to put more acid, it's going to burn more.
Yeah.
Well, yeah.
Right.
I hate to say that, but
we have a lot of examples of that working for people.
Exactly.
Right.
You've got to get that skin rejuvenated. You've got to get that skin going before it's going to become less sensitive.
Yeah. I just want to say welcome to a few more people that have come in. Rita, Melody, and I know that Marlis isn't the one who wrote it, but it looks like maybe Marlis is watching. I know you'd like to say Hello
Marla.
to all of them, everyone on your staff. Robin, so we're looking forward to your feedback on this. If this is something that you all appreciate, we will do more of these. I think you're up for it, right?
Oh, I'm going to hear about it when I get back to the office.
They're planning the jokes right now. We have a number of other questions, but I actually want to jump to one that is plastic surgery related, because you are obviously a practicing board certified plastic surgeon. You know a thing or two about this. This is from Mary, who had an upper blepharoplasty 20 years ago, and it's starting to fall. She's wondering if there's a nip and tuck procedure that can be done for the upper eyelids. This is also in line with a question from Sue. She's, I believe she's a Revitalize user, but she's wondering if there's anything else that can be done for the lines around the eyes.
Well,
So I guess that's outside of a
again,
a
let's
topical.
answer that one first,
Yeah.
because yes, non-surgically, there's certainly Revitalize helps with the biology of the lower. I mean, I'm not going to get into that because that
Right.
will take a while, but we know it helps with the biology of the lower lid and tightens it and reduces the edema or the swelling, and so it makes the bags look better. But certainly exfoliation, which we've been talking about, works great for that part of the area too. Of the facial area too. So
this delicate area,
delicate
even
area-
though we're always told,
yeah, stay away
they
from
say
any.
use your pinky finger, your ring finger, because
Yeah.
it's so delicate. But
Yeah, absolutely. But so you don't apply the same amount of say L-glycine is what you're using to exfoliate. You don't apply the same amount as you do to your elbow,
a thicker area of skin.
area of skin to exfoliate. So peeling will work just as well for that area. You just get closer, don't get the stuff in your eyes, and
Yeah.
and that will improve the skin tone, the skin tension, and tighten it, just to a point where it may be more acceptable.
Mm-hmm.
Now, after a certain point, when the skin becomes really lax and the muscle underneath there's a muscle called orbicularis that over time stretches out, and the fat pockets underneath herniate. Now, these are all mechanical things that are happening that external products aren't going to do much for, and that's when surgery comes into play. So getting lower eyelids and upper eyelids done is a very common procedure. I do these a lot. But you have to pick the right candidate for it. If somebody in their 30s who's got some sun damage, skin that shows a little bit of wrinkling, can probably get away by using products. And Revitalize would be a wonderful product for somebody in that age group with that kind of issue, even in their 40s. But we start getting into the 50s, 60s, 70s. Now we've got skin that's loose, that skin that's muscle that's loose, the fat that's herniating forward, right underneath here, or the skin that's loose on the upper eyelids. One of the most commonly misdiagnosed problems in the upper eyelids is the upper eyelid itself. It's usually not an upper eyelid problem, and I have a real problem with that, because you can see I'm sitting here, I'm raising my eyebrows, because if I didn't, I'd look like this, and that's no good, right? and that's my brows.
Yeah.
So that's a very commonly misdiagnosed problem in plastic surgery. People come in looking like this and say, "Look at all this extra eyelid skin I've got."
But it's
really the brow. If I put my
lifted.
brow where it's supposed to be, I don't have any upper eyelids issue.
Yeah.
And so the right diagnosis is very important.
Mm-hmm.
So for upper eyelids, the right diagnosis and then treatment of that, whether it's a brow. So if somebody had eyelids done 20 years ago, I suspect, I'm not sure how old Mary is, but if she had her upper eyelids done 20 years ago, maybe she needed her brow done too. And maybe now all she needs is the brow done to fix the what's coming down, if you may.
Okay.
I mean, chances are, once the upper eyelids are done, the eyelid skin hasn't got loose again.
Mm-hmm.
But the brow certainly has been coming down and is still coming down.
Mm-hmm.
So fixing that may be the answer. Whereas, for Sue, was it?
Yes.
It may just be a product issue. Again, I'm not sure how old
About
Sue is.
ages, but as you get
But
older, the issue becomes more surgical.
Correct.
Okay.
Correct. So the diagnosis, I think the diagnosis is most important. The treatments are pretty straightforward, even though they're surgical and they sound scary.
Right.
They're pretty common.
We do have a question that came in from Crystal, and it's, what is the best skincare routine when I'm traveling? That's a good one, especially if you're traveling by plane and you're in dry conditions.
Mm-hmm. Make it simple.
Yeah.
Make it simple because, to define a skincare regimen when you're traveling versus when you're not traveling, you're just complicating your life.
Mm-hmm.
And so, like I said, cleanse, exfoliate, moisturize, and protect. So whether you're traveling or not, you're
The
gonna,
rules are always
the
the
rules are
same.
the same. You're gonna cleanse your skin.
Yeah.
Exfoliant. That's why something like Aloglycine is made so simple to use. You put it on, you forget about it.
Mm-hmm.
You do it once, and so when you're traveling, just do it at night when you go to bed, unless you're partying all night, then you have to wait till the next day, I suppose.
But something like Tone and Balance, a spray product that you could use in flight to keep your skin hydrated and comfortable.
Right. You notice, I was just I had a little travel size hand and body lotion that I use for my hands all the time because my hands are always dry because I wash them so often during the week for surgery.
And it being winter in
and
the
so,
Midwest.
So, carry your skincare products with you in an easy to use way.
Yeah.
And again, keep your regimen easy. It's simple. You cleanse, you exfoliate once before you go to bed. And keep something with you when you're traveling, say on the airplane, like you said, a toner, just spray that on, or keep your little bottle with you and put that on once in a while.
Yeah.
For moisturizing.
And then adding in specialty products based on any specific concerns, like the eye cream, if you have concerns in that area, a serum.
Well, if you're using your eye cream every day, then there's no reason you can't carry it with you. It's pretty small.
Right.
It's less than the TSA.
Yeah, it's under 2 ounces,
yeah,
so you're good.
So
it should be actually all of the products that you need on a regular basis.
We
offer in the sizes that you would need. So.
Exactly. And if you're going to an area where there's going to be a lot of sun, carry your sunscreen with you.
Right.
I mean, you're going to do that anyway.
You got to wear that sunscreen.
And
that's
and
one of your
and the
rules.
sunscreen that there's a reason I made the sunscreen easy to use. Spray it on and go. You don't have to sit there, take it out, rub it on.
Yeah.
So keep it easy, keep it simple, and just do the same things every day, whether you're traveling or not.
Yep. So we are going to get ready to wrap this up here, but I wanted to ask you a question, and I know that Aloglycine is probably the product you're most proud of, but I'm curious, after Aloglycine, what is your absolutely most favorite Lexley product?
Well, mine is the hand and body lotion because I use it a lot.
I'm surprised by that one.
Well,
it's a great product.
I live
but
in
it's
Fargo,
so,
North Dakota.
Yeah.
I use it on my face. I get dry very easily.
Yeah.
And especially my hands, so I use that a lot. And after that, probably the one after that is the Tone and Balance because that's the only thing I use as an aftershave.
It's a great multi-purpose product.
Great multi-purpose product.
Ah, good. Well, and I see that we've got someone commenting on Lexley sunscreen. It is a great product. We were really having a great time doing this. We want to do this again sometime. I think we'll schedule one for the next couple of months. It's easy, it's fun, it gives us a chance to interact with all of you.
And we sit and watch our phone and kind of talk into it and see these things flying across, which are kind of cool.
And we never sit this closely, so this is really interesting.
Look, there's a heart that just flew by. That's kind of
Oh,
cool.
look, we got some laughter.
We got some laughter
Do
flying
you want
by.
to tell a couple jokes? Any closing thoughts before we turn this camera off?
Well, the thing about skincare is keep it simple. I don't care what other regimens talk about. Keep it simple. Just cleanse, exfoliate, moisturize, protect, and go about your business. If you keep it simple, it'll work.
And buy
and
Lexley.
and use the right products. That's our
Lexley. Thank you so much, Dr. It was so good
Thank you,
to do.
Stacey.
This was
That was
fun.
fun.
I
Yeah.
think that we will be scheduling another one soon. So we'll let you all know, and we'll give you a chance to send your questions in advance. And this will also be archived on our Facebook page, so we will give others a chance to watch that as well. Thank you all for joining us.
Thank you. Bye-bye. I think I'm saying bye-bye.
You are. Good job.